I called Aaron and said, why don't we go see if we can't convince him to finally do this study?
I flew down to Michigan and we went to meet Dr. Zervos in person. We said, look, here's your opportunity. The results should be directly in line with the orthodoxy. The vaccinated kids should be healthy across the board. He could be hailed a hero for finally shutting up the anti-vaxxers. He said he's willing to do it. The study was going to use the data they literally already have in their fingertips. The data of millions of people who are already in the Henry Ford Health System database, including hundreds, maybe thousands of completely unvaccinated children, as well as obviously children who are vaccinated. What that would allow is taking that multi-million person database, segregating out the children who had been in the Henry Ford system from birth continuously for a few years. Because it's a captive HMO environment, meaning it provides the insurance and it provides the medical care, it has most of the health records for these kids, including if they go out of the Henry Ford medical system, Henry Ford, as the insurer, was still paying for it. So they had the health codes for all the medical services that these kids got. So if you segregated out those kids, now you have a cohort of children from birth for at least a few years where you knew everything about them.
I previously was a program director at Henry Ford Hospital, so I know it well. It's one of the best integrated health systems to do research.
Henry Ford receives over $90 million in annual research funding, with nearly 700 residents and fellows in 53 ACGME accredited training programs.
I think Henry Ford, like other institutions, has a bias towards the goodness of vaccines.
You can't miss it. It's a full-page letter here from Henry Ford with 56 signatures saying in bold letters, the science is clear, vaccines save lives.
If the results came back demonstrating that the battery of vaccines was associated with chronic diseases and that unvaccinated appeared healthier over time, such a result would be particularly convincing.
I'm for vaccines. I'm not, I'm obviously for vaccines, but I think it's the best way of controlling infectious diseases, which are deadly. I'm for mandatory vaccination. Henry Ford is mandatory vaccination because of me.
Henry Ford is one of about 90 healthcare systems across the United States that are working to enroll a total of 30,000 volunteers in the Moderna COV vaccine study as quickly as possible.
This is the worst pandemic of the last 100 years, and our best hope of dealing with this is by having an effective vaccine.
Henry Ford is requiring all 33,000 staff members to be fully vaccinated by September 10th, 2021.
The health system says this is consistent with its existing vaccination policy, which includes team members get the flu shot every year and stay current with other vaccinations.
It appeared to me that Henry Ford was pro-vaccine, not anti-vaccine. So I had to assume the only reason they would do this study was to prove us wrong.
Dell and I thought that was an excellent opportunity. They can do the comparison and presumably they could get it published.
We only had one request.
The ask was, whatever the outcome, you publish it. Would he stick to that if the results show that unvaccinated kids are healthier? And when he realized that if he submitted that for publication, he's going to face the wrath of his entire profession, didn't know.
This was our greatest fear. I mean, vaccines are the holy grail of modern medicine, and anyone that decides to challenge vaccines in any way are essentially considered heretics.
Vaccines are safe.
Vaccines are safe and effective.
Vaccines are safe and highly effective.
Safe and effective.
Safe and they're highly effective.
Vaccines are one of humanity's most incredible accomplishments, and they've saved millions of lives.
Childhood vaccines have prevented about 4 million deaths around the world every year.
The overwhelming majority of pediatricians in this country strongly support vaccinations.
Missing her vaccination dates.
We're not vaccinating.
The schedule as it's currently recommended is well tested.
We've studied them in so many millions of children.
Billions of people.
Decades of extensive peer-reviewed scientific studies.
Centuries of science.
The science is pretty settled.
Settled for many years now.
This idea that we're taking too many vaccines, there's really no science to back that up.
The scientific community publishes paper after paper after paper.
There is nothing to see. There's nothing to see.
I will not stand here and let conspiracy theories distract from real solutions.
Most doctors can't tolerate being called quacks or having their reputation destroyed. And I went from treating at the head of the laboratory at my hospital for hypertension to becoming, somebody that was doubted on every levels after a while because of one thing that I said, which was, can we stop giving vaccines to my sick patients and give it to them on the day of discharge? And had they not tried to intimidate me, doubt me, and pushed me to research and show that what I saw was actually real, I would still be lockstep working as a regular doctor.
The Florida Department of Health, in partnership with the governor, is going to be working to end all vaccine mandates in Florida law. All of them. All of them.
My experience with discussing or disclosing harms associated with vaccines is that those are not welcome ideas or conversations.
That move from the Florida Surgeon General, a doctor there, drawing condemnation from public health experts.
Whether it's ignorance, it's stupidity, or it's malice, at the end of the day, people are going to get hurt.
He's not going to necessarily receive a warm embrace by some of the people in his profession, but that's really what courage is all about.
It's a very hostile environment, both scientifically and in the media, for individuals who reach conclusions or have opinions that counter mainstream ideas.
Every independent scientist that has ever ventured into doing a vaccinated versus unvaccinated study of any kind is immediately under assault. There's one by Dr. Anthony Mawson out of Mississippi. He did a homeschool study of about 600 kids and discovered alarming rates of allergies, ADD, ADHD, neurological disorders, and a fourfold increased risk of autism amongst the vaccinated. As soon as the study came out, his job was under threat. In fact, I asked him if he'd be in this film, and he said, look, you can show my studies, but I have just been dragged through the coals on this. I can't take anymore. Then there's Dr. Paul Thomas.
Hey, how you guys doing?
What I'm seeing on this side is a pink, dull, scarred up eardrum. I've been a pediatrician for 35 years. I'm now retired. What I noticed in the first decade or so of my practice is kids were getting sicker and sicker. And over the next decade, as more and more patients chose not to vaccinate, I got to see the difference. But I wanted to see, could I prove it? So we got all the data from my practice. We looked at every baby born into my practice and published it in an international journal of public health. What we found, and that study was peer-reviewed, it was robust, we found massive increases. I mean, we're talking 400 to 500% more. Allergies, autoimmune conditions, neurodevelopmental issues, and then we had infections of all kinds, massively increased in the vaccinated compared to the unvaccinated. What happened when I published that study? Within days of it being available online, I get a call from my attorney. Don't go see any patients, don't write any prescriptions, don't go into the office. Your license has been emergently suspended. You are a threat to public health.
What's today?
Today, it is the last time I will be doing clinical medicine in Oregon. Knowing that you guys are keeping it going, the heart of this place lives on.
So what if Dr. Zervos does this study and it turns out exactly the same way as the others? Would he still publish it? That was the question.
Years went by. In 2020, I was informed they had put together a study. And I had that study in my hand and I looked at it. The significance of it, it was an actual study that, when published, was the first step in changing this landscape. Weeks went by and then more time went by, and at some point, what I learned was it was not going to get submitted for publication.
Aaron called me and said they finished the study. Only one problem, they're not going to publish it. I mean, it was everything we were afraid of. I called Dr. Zervos and I said, can I fly out and meet you for dinner? And he agreed. I wanted to look Zervos in the eyes and ask him, what's so damning in this study that you're afraid to publish it? I wanted to know what was in this study. I hadn't seen it. I also imagined there's got to be a way to talk him into publishing this study. But one thing was for sure, this was my last chance. I'm going to bring hidden cameras and recording equipment so that no matter what happens at this dinner, I can prove it happened. What do you think about the study you guys have done?
It's important information because of, it did show a difference between the groups. I don't know how to.
Oh, she got it.
How to explain? I don't know how to explain it, but it's important. It was an important finding. The study was for what.
Do you find any flaws in the study? I mean, is there a way they could do the study? You can do the study better with what's there?
Not that I know.
No.
That I know.
Impact of childhood vaccination on short and long-term chronic health outcomes in children, a birth cohort study.
This one is really robust.
Let's say the results.
Yeah, what were the results?
The CDC put out a white paper on how you would look at vaccinated versus unvaccinated, and we followed it to a T.
I agree with that.
No.
Do you agree with that?
No,
We 100% did. We looked at this every other way and sideways.
I think this is a devastating commentary on our public health interventions, because if this is true, we are systematically making kids sick, and not just a little bit sick, very sick.
Publishing something like that, I might as well retire. I'd be finished.
I mean, I'm just curious. What in this data makes you think it will be as catastrophic to your career as you think? What was he so afraid of? The study was a bombshell.
18,468 subjects, 1,957 of them were fully unvaccinated. When comparing the health outcomes of the vaccinated versus the unvaccinated, they found an increased risk in the vaccinated of several chronic health conditions. The vaccinated subjects were over 4 times more likely to have an asthma diagnosis.
4.29 times in the adjusted. And that seems, I've looked at a lot of studies, that's 3.26 to 5.65.
They also found 3 times the risk for atopic diseases,
which is kind of a subset of allergic diseases.
They found almost 6 times risk for autoimmune disease.
The autoimmune diseases this paper looked at include thrombocytopenic purpura, rheumatoid arthritis, SLE, systemic lupus erythematosus, MS, multiple sclerosis, and Guillain-Barré syndrome. They mentioned there are over 80 different autoimmune diseases, and what their data showed for autoimmunity, 6 times increase in those who got vaccines when compared to the unvaccinated.
Which is staggering, because autoimmune disorders really represent significant morbidity and health costs and suffering, accrued over a lifetime.
Neurodevelopmental disorders.
What kind of numbers are we talking about? Do you remember?
5.5 times risk for neurodevelopmental disorders.
We know that the immune system is intimately connected with both brain development and brain functioning. And so when the immune system gets triggered by illness, potentially by vaccination, you can get neuropsychiatric symptoms, presumably related to brain inflammation and immune processes in the brain.
2.92 times the amount of motor disabilities, 4.47 times the amount of speech disorders in the vaccinated compared to the unvaccinated.
3 times the rate of developmental delay.
They found the same things I found related to allergy and autoimmunity. Also, 6 times more acute and chronic ear infections.
Interestingly, there were several health conditions where they couldn't even do this analysis because there were none in the unvaccinated group. The way that the mathematical formulas work, you can't have a 0 in any one group and be able to compare risk.
For example,